Can you get pregnant if your periods are irregular? Many people believe irregular periods mean infertility. But is that really true? The answer is not as simple as yes or no. In this video, we'll explain what irregular periods mean, how ovulation works, and whether pregnancy is still possible. Stay till the end. This might change how you see your body. A typical menstrual cycle lasts about 28 days, but a normal cycle can range from 21 days to 35 days. Periods are considered irregular when the timing changes often. For example, your cycle might be 26 days one month, then 34 days the next. Or you might skip periods for several months. Some people bleed very lightly, others bleed very heavily. All of these can be signs of an irregular cycle. And here's something important. Irregular periods are very common. You are not alone. Periods are controlled by hormones. These hormones tell your ovaries when to release an egg. When hormones are unbalanced, ovulation becomes unpredictable. And when ovulation is unpredictable, periods become irregular. Here are common reasons why this happens. Hormonal imbalance can delay or stop ovulation. Polycystic ovary syndrome, also known as PCOS, can cause skipped or delayed periods. Thyroid problems can affect your entire cycle. Stress can delay ovulation. Sudden weight loss or weight gain can stop ovulation temporarily. Poor sleep and extreme exercise can also disrupt cycles. Age matters too. Cycles often become irregular in the teenage years and again before menopause. So, can you get pregnant? Yes, you can get pregnant with irregular periods. Pregnancy does not depend on regular bleeding. It depends on ovulation. If you ovulate, pregnancy is possible, even if ovulation happens late, early, or only sometimes. The challenge is timing. With regular cycles, ovulation is easier to predict. With irregular cycles, ovulation can surprise you. This is why some people with irregular periods get pregnant unexpectedly, and others take longer to conceive. Irregular does not mean impossible, it means unpredictable. Ovulation is key. Without ovulation, pregnancy cannot happen. But here's the important part. You don't need a regular period to ovulate. You can ovulate even if your periods are rare. You can ovulate even if your last cycle was long. And once ovulation happens, the egg can be fertilized. Sperm can live inside the body for up to 5 days, so timing matters more than cycle length. Even with irregular periods, your body may give clues. One sign is cervical mucus changes. Around ovulation, discharge becomes clear, stretchy, and slippery. Another sign is a slight rise in body temperature after ovulation. Some people feel mild pain or pressure on one side of the lower abdomen. Ovulation predictor kits can also help. They detect a hormone surge that happens before ovulation. Tracking these signs can help you understand your fertile window. Let's clear up some common myths. Myth 1. Irregular periods mean infertility. This is false. Many people with irregular cycles get pregnant naturally. Myth 2. You must have a period to get pregnant. Also false. Ovulation can happen without regular bleeding. Myth 3. Irregular periods mean something is always wrong. Not always. Sometimes cycles are irregular due to stress, lifestyle, or temporary changes. If you are trying to get pregnant, there are helpful steps. Track ovulation signs, not just calendar dates. Focus on healthy habits. Eat balanced meals, manage stress, get enough sleep. Avoid extreme dieting or over-exercise. If you've been trying for a long time without success, talk to a healthcare provider. They can check for hormonal issues, PCOS, or thyroid problems. Sometimes treatment can help ovulation become more regular. Irregular periods are not birth control. Ovulation can happen unexpectedly, and sperm can survive for days. If you want to avoid pregnancy, use contraception consistently. Do not rely on irregular cycles for protection. Irregular periods can feel frustrating. They can cause anxiety, confusion, and self-doubt. But hear this clearly. Irregular cycles do not define your fertility. They do not define your future. Your body is not broken. Understanding your cycle is a powerful first step. Support, education, and medical care can make a big difference. Let's summarize. Yes, you can get pregnant with irregular periods. Irregular cycles mean unpredictable ovulation, not infertility. Tracking ovulation and caring for your health can improve your chances. And if you have concerns, professional guidance matters. Knowledge gives you control. If this video helped you, share it with someone who needs clarity. Subscribe for more honest women's health education. Your cycle is unique, and your fertility story is still unfolding.